Welcome back. You made it to the halfway point of our video series. Together, we talked about the science behind COVID-19, what public health officials are doing to keep us safe, and how is Michigan being impacted. We hope you continue to view this series as we continue to talk about ways to maintain your health in your home. The second half is a series of videos on practical skills you can implement at home. We recognize the amount of information floating around can be overwhelming, but our goal is providing you with concise information at your fingertips. Everyone is hitting the internet for their up-to-date information on COVID-19, but what are you doing to make sure the information is correct? We here at the University of Michigan-Flint and our partners, the Evergreen Community Development Initiative, with funding provided by the W.K. Kellogg Foundation through the University of Michigan-Flint's Flint Truth and Action Partnership Project, want to ensure the information you are receiving is reliable, trusted sources. The following videos will touch upon crucial steps you can take to keep yourself healthy and safe. All information can be found through the Centers of Disease Control, CDC, World Health Organization, WHO, and other trusted sources of information on the COVID-19 pandemic. We urge you to make thought-out choices when you surf the web. Ensure what you are finding is accurate, concise, and practical. Before we begin our next set of videos, the people involved are active members in the community with different backgrounds. I and other speakers in this series are not licensed medical doctors. We are scientists investing in bringing you up-to-date information for your viewing purposes. If you have specific medical concerns, please contact your primary care or doctor to get medical advice that is specific to you. Your doctor and healthcare team are experts in understanding you and can provide you with information regarding your health. Give them a call. Some of you might be still working with the public, deemed essential by the public health officials. If you do not fall under this category, Michigan has in place a stay-at-home order. Executive Order 2020-21 imposes a temporary requirement to suspend activities that are not necessary to sustain or protect health. But what does that mean? Well, bottom line is, if you're not protecting or sustaining health, then you must stay at your place of residency. However, you are allowed to leave your house to engage in outdoor activities, to perform jobs as critical infrastructure workers, to perform tasks necessary to your health and safety, to obtain necessary services or supplies, to care for your family or pets in another household, or other deemed tasks which are outlined in this order. If you need to leave your house, make sure you are following the guidelines set out by the Centers of Disease Control, World Health Organization, and the Michigan Department of Health and Human Services to ensure you are keeping yourself and others around safe. If you do leave your house to perform one of the various tasks, there are some guidelines you should follow. First, maintain good social distance. Social distance is this fancy trend to minimize the spread of the virus. The CDC defines this as physical distance that keeps space between yourself and other people outside your home. They urge people to maintain a distance of 6 feet from other people, not to gather in groups, and to stay out of crowded places and avoid mass gatherings. Health professionals know this virus can spread easily among people who are in close contact. It takes one sneeze, cough, talk, or droplet from an infected person to spread to others. Furthermore, there are some cases of COVID-19 where individuals are not presenting any symptoms at all, so making sure you keep your distance protects you and your household from this deadly virus. As always, tips for social distancing can be found on every government-sanctioned website, and always follow guidelines from authorities where you live. Many open businesses, such as grocery stores, have already implemented social distancing standards by placing stickers or sending posted guidelines. As always, Tips for social distancing can be found on every government-sanctioned website. And as always, follow guidance from authorities where you live. Many open businesses, such as grocery stores, have already implemented social distancing standards by placing stickers or posting guidelines. Remember, social distancing is not to punish you. It is to stop the spread of COVID-19. Second, if possible, practice good hygiene and if able, wear personal protection equipment or PPE. Personal hygiene is referring to the practice of keeping yourself clean. Now, more than ever, it is crucial to keep yourself clean. COVID-19 can pass on surfaces, so washing hands and sanitizing dirty surfaces is the right way to go. Personal protection equipment is a general term to designate clothing or items that are meant to protect contact of a potentially dangerous material. In this instance, we are protecting ourselves and others from COVID-19. Right now, studies have shown PPE, if worn correctly, can minimize the risk of transmission. COVID-19 is a deadly disease with future consequences we are still not sure about. Remember, if you are experiencing fever, shortness of breath, or a dry cough, call your local health provider to plan on the next steps you should take to minimize the spread. CDC states that if you test positive for COVID-19 or is deemed at risk for the infection, such as exposure, healthcare providers can ask you to self-quarantine. This means that you should stay separate from others and limit movement outside from your current place. Quarantine helps limit further spread of COVID-19. It takes all of us practicing good habits to stop the spread of COVID-19. To protect yourself, your family, and your community, always follow guidelines set out by your authorities. Remember, stay at home, and if you do, always social distance and wear approved PPE when possible. Working together, we can stop the spread of COVID-19 here in the Flint community.